Hello, I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And today I'm going to present to you the abstract Iberdomide in combination with Dexamethasone and Daratumumab, Bortezomib, or Carfilzomib in patients with relapsed and refractory multiple myeloma. I presented an update of Iberdomide in combination with these drugs, Dara, Bortezomib, or Carfilzomib, as part of the original CC220MM001 phase 1 expansion study. We've totally enrolled a number of different patients in many different cohorts in this trial, and what we're going to focus on again are really these three IBER combination cohorts, Dara, Bortezomib, and Carfilzomib. In the Dara arm, we had 43 patients. In the Bortezomib arm, we had 25 patients. And in the Carfilzomib arm, we're pretty early and have only 9 patients in total. In terms of adverse events, there really was nothing new with the combination of IBER with any of these backbone agents. The toxicity of Iberdomide, as you know, has been pretty modest in terms of both heme and non-hematologic toxicities. And this didn't change significantly when combined with any of the 3 drugs that I've mentioned in this combination. In terms of best response in the Iberdomide plus Dara Dex combination, the overall response rate was about 45.9%, with some patients achieving stringent CR and VGPRs, and in fact, many of those being quite durable beyond 20 cycles of therapy. For the Iberdomide plus Bortezomib and Dexamethasone combination, the overall response rate was about 56%, again, with patients achieving deep responses, including CR, VGPR, also with many patients continuing to be in response beyond 20 cycles of therapy. And finally, for the Iberdomide Carfilzomib Dex combination, the overall response rate was about 50%, with patients achieving CR and VGPR as well. This is a little bit shorter in terms of follow-up, so the average duration of response has not been reached yet, but the median time to response was about 1 month or 4 weeks in total. So I think in conclusion, what we demonstrated in this trial was that Iberdomide nicely combines with Dara, Bortezomib, or Carfilzomib. And this is actually really important because Iberdomide is, I think, hopefully an active agent that we'll have very soon to use in our treatment armamentarium for patients with myeloma. The new adverse events were relatively minor, with very few grade 3, grade 4 new events other than what you'd expect for the partner agent. The recommended phase 2 dosing of IBER was 1.6 milligrams in the Dara combination, while the dose escalation continues in the Bortezomib and the Carfilzomib arms, and this ultimately will lead to randomized phase 3 trials testing these combinations with or without Iberdomide. Thank you for your attention.